Influenza is a common disease across the world. But in Africa, it can be deadly. Most of the research into flu has taken place in developed settings. The World Health Organization says the impact of flu infection in Africa is not very well documented. But in terms of what we do know, it's significant. It's a major cause of death among children in sub-Saharan Africa. Recent flu outbreaks include countries like Madagascar and the Democratic Republic of Congo. More recently, the avian influenza virus H5N1 has also been affecting poultry in Africa. The most significant number of human infections of that strain has been in Egypt. The lack of documentation when it comes to flu cases points to an urgent need to strengthen surveillance systems on the continent. Competing public health needs is another issue for the continent. Funding has been burdened by several other diseases and outbreaks. The easiest way to treat flu is through vaccines. Several African countries have launched vaccine drives in recent years. Still, millions of people in Africa still do not have access to vaccinations. And there's a lot of work ahead to address that. Susan Mwongeli, CGTN.
Well, let's get you some perspective now on influenza in Africa. I'm joined live in studio by Dr. Joseph Aluoch, a chest physician based here in Nairobi. Doctor, starting here in Kenya, just how much of a concern is influenza and why?
Well, it is a concern, but I will not say much of a concern. We have poor statistics like most places in Africa, but some of the work that has been done show that less than 7% of the population are ever affected each year. And in any case, Kenya being a tropical country, the impact of influenza is not as much as in the temperate countries like Europe and America who have severe winters. It does not affect that much. Then the strains are also different. So I would not raise an alarm over the concern of influenza.
However, the World Health Organization is raising a small alarm on the lack of data, as you said, the lack of statistics. What can health authorities do across Africa to improve the data?
First and foremost, to make the public aware. Most patients do not report for treatment or for consultation. And so because there's lack of knowledge among the patients and the health workers, so that they do not know what is influenza and what is ordinary flu, what we call common cold. And a lot of people just stay at home, maybe drink a tot of brandy, says, oh, I just have a simple flu, it will go away. And secondly, when they go to the hospital, the doctors may not have a so-called high index of suspicion and just treat it as a common respiratory tract infection. And finally, most important, we lack the facilities to make diagnosis. Viral diagnosis is difficult anywhere in the world, and more so in Africa. It needs special machine and special trained personnel to make a diagnosis of viral diseases, collecting the specimen, transporting them to the nearest laboratory, and using the basic tools available to make the diagnosis.
You did mention, of course, that regions like the Americas have very harsh winters.
Yes.
This winter in particular, they're experiencing quite a worrying outbreak in influenza cases, also concerns that vaccines over time have become less effective. Is this something that, that doctors in Africa are paying attention to?
Well, we're not really worried about that. First of all, the vaccines do not prevent you from having the influenza. It only makes the influenza a less dangerous disease. And more so in people who have got what is known as pre-existing conditions. In our case, the commonest reason that we recommend influenza is people with HIV. Because when they do have influenza, it becomes a very serious problem. Or children with heart disease, or with asthma, or with who are malnourished. These are fellows, when they get influenza, they do suffer greatly. But giving vaccine will only make the seriousness of the disease less, but it doesn't stop you from having influenza. You still have influenza infection in the community.
All right, Doctor, we'll leave it there, but thank you so much. That, of course, is the Africa perspective on influenza.